Hey, Miss Shandick.
Hi, how are you?
Hi, good. How are you doing today? Chandler Zalick, student nurse practitioner.
It's very nice to see you again.
So what brings you in here today?
Full body assessment.
Okay.
Okay.
All right. Awesome. So I'll just sit down with you, ask you some questions. Just for your records. If you could just tell me your name.
Jennifer Chandick.
Perfect. Your date of birth.
4/28 of 1993.
Perfect. Your past medical history.
Exercise-induced asthma when I was younger.
Sure.
Anxiety.
Mm-hmm.
Acid reflux and IBS.
Okay. Any allergies that you have to medications?
Just Prevacid and penicillin.
Sure. Any environmental? No allergies at all. Okay. Are you up to date on your immunizations?
I am.
Did you get your flu shot last?
I did.
Perfect. And do you know if you've had your tetanus shot within the last 10 years?
I have.
All right. Perfect. Any recent surgeries at all?
I had a breast reduction back in January.
Back in 2019?
Yes.
And any complications with that?
No.
Are you still following up with that surgeon at all?
I haven't been back since my last follow-up.
Okay, but
It
he
was in
cleared you?
February. I was
All right.
completely cleared.
In February. Excellent. And was he here with the network?
He is outside of the network but works with the network.
Okay. Excellent. Any medications that you're currently taking?
I take Lexapro.
Yeah.
And then my albuterol PRN as
Sure.
needed.
And do you know the dosage on that Lexapro by chance?
5 milligrams.
5 milligrams. Perfect. Any complementary treatments that you get outside? Any massage therapy?
I do an hour massage like once a month, and then
Okay.
I have a therapy session every other week.
Perfect. And how's that been working for you?
Perfect.
All right. So any pertinent family history? Any cancer or heart attacks? Anything like that?
Just high blood pressure and heart disease.
Sure. And who has that?
So it all runs on my grandfather's side.
Okay. And is that your mom or your dad?
My mom's father.
All right. And Ms. Chindig, your education level?
I have my bachelor's degree from Kutztown University.
Perfect. And your occupation?
I work as a technical partner for Lehigh Valley Hospital.
Excellent. Your current living situation?
Live with my family.
Sure.
Small family home.
Okay. Any kids at all?
No kids.
All right. Do you smoke?
I do not.
Okay. Do you drink at all?
Socially.
Just socially, sure. About how many drinks would you say you have a week?
1 or 2.
Okay. Perfect. Do you do any recreational drugs?
No.
Any smokeless tobacco?
No.
All right. Any recent travel outside the country?
Nope.
All right.
I wish.
Anything you want to talk about? Any current life stressors or anything like that that's kind of going on at all?
No.
No? You seem like your health is pretty good?
Yeah, I feel so good.
All right. Perfect. Well, I'm all out of the way with the questions so we can start the assessment, okay?
Awesome.
All right. Just wash my hands. Let's get some hand sanitizer and put some gloves on. All right, so it is a head-to-toe assessment, so it's kind of going to be run exactly how it sounds, all right?
Okay.
At any point, if you feel uncomfortable, if you have any pain, any tenderness, just let me know and we can certainly stop, okay?
Okay.
So first off, I'm just kind of inspecting you and visualizing your general state of health. You look good. You don't look out of breath. You've got a good complexion to you. Your skin looks soft, dry. Just going to generally feel perfect. All right. So what I'm going to start with is your scalp. I'm just going to inspect your scalp. Okay, for any lesions, any abnormalities, any tenderness. Good, and now I'm just going to palpate it, okay? You let me know if you have any pain at all. I'm feeling for any masses or abnormalities. No deformities. Now I'm going to look at your face. I'm going to inspect it. It looks symmetrical. It is pink, moist, perfect. No lesions or anything like that. Now what I'm going to do is I'm going to palpate for your maxillary and your frontal sinuses. Let me know if you have any pain at all with this, okay? All right. Perfect. So now I'm just going to palpate your TMJ. Any pain there at all? No. Okay, can you open your mouth for me? Close your mouth for me. Perfect. Move your jaw to the left, to the right. Perfect. All right. And can you kind of move it forward? Good. And move backward. Excellent. Great. And can you push down on my hand? Perfect. And open your mouth. And don't let me close. All right, good. Your jaw strength is definitely intact. Now what I'm going to do is I'm just going to occlude one nostril at a time and just have you breathe in, okay? I'm just going to be checking for symmetry. Perfect. All right, and does that feel the same at all? All right, not blocked or anything like that? All right, so now what I'm going to do is I'm going to take a look into your nostrils. What I'm going to be looking for your turbinates, the mucosum, and the septum. Excellent. It looks like an even hair distribution, a pink moist mucosa, no lesions or abnormalities or anything like that, no septal deviation. So now what I'm going to do from there is I'm going to do something called the smell test. So I'm going to have you close your eyes, and I'm going to include one nostril at a time and let me know what you smell, okay, and if it's the same on both sides. Perfect. All right. Excellent. So now I'm going to take a look at your ears. I'm going to palpate them. I'm going to pull back the pinna. I'm going to look for any tenderness or any lesions. Any pain there?
No.
I'm going to do it on both sides. Any pain there?
No.
Okay. No tenderness. I don't feel for any deformities or anything like that. I'm going to now look into your ears with the pen light. We'll start on this side. I'm just going to be looking for landmarks, inspecting the ear canal. Excellent. I don't see any redness. No tenderness at all. Okay, so I saw the landmarks. There's no erythema. The TM is intact. Your ears look good. Any hearing problems that you've noticed at all? No? Okay. Perfect. So now we're going to go to the eyes. I'm just going to generally inspect. I'm going to be looking at your eyelids. Go ahead, you can close them for me. Perfect. I'm going to be looking at the eyelashes. You have an even distribution of hair. I'm going to be looking at the conjunctiva, the sclera. I see no obvious exudate or anything like that. Do you have any problems with eye drainage at all? Nose drainage, ear drainage? No, nothing that you've noticed? Okay, perfect. So now what I'm going to do is I'm going to shine that light into your eyes.
Okay.
I'm going to be checking for pupil reaction. Perfect. So your pupils are equal and they're reactive to light, and they go from 4 millimeters to 2 millimeters when the light hits, which is an appropriate response. So I also was able to see the consensualization between both those eyes, so that looks good. I'm going to take that light again. I'm going to be looking for a red reflex, and I'm going to be looking at an optic disc, okay? Good, I see that red reflex. All right, optic disc looks intact. All right, so now what I'm going to have you do is I'm going to have you cover one eye at a time, and I'm going to check your peripheral fields. Okay. So I'm going to be looking, I'm going to hold a number in the air, and I want you to tell me what it is, okay? But keep that head nice and midline.
2, 3, 2.
Perfect, and you can cover the other eye. We'll do the same thing.
2, 3, 4.
Perfect. All right, so now you can look straight at me, and you can just cover one eye. I'm just going to be looking for pupillary alignment. Perfect, and you can go ahead. The next one. Perfect. Okay, any changes in your visions at all recently? No? Everything seems to be okay? All right, so now this next test we're going to do is, have you ever seen one of these? It's called the tuning fork.
I have.
All right, so you've been tested with it before?
For hearing.
Okay,
Yes.
yeah, perfect. All right, so I'm going to perform a Weber and a Rhine test for you. And it's just going to be testing the hearing and how it kind of circulates through your head and everything like that, okay? So I'm going to strike the fork to the middle of my hand. I'm going to place it on the top middle of your head. I want you to let me know when you don't feel the sensation anymore, okay?
Okay.
Perfect. All right, so now what I'm going to do is I'm going to place this on either side of your ears, and I want you to let me know if you hear it in the side I have it placed on, or if you hear it in the side I don't have it placed on, or if it travels throughout, okay?
It travels.
Okay, so which ear did it start on?
It started on this side, went through to this side.
Perfect. Let me know when you stop hearing it.
It stopped.
All right, excellent. We're going to do the same thing on the other side.
Same, and it just stopped.
It just stopped. Okay, excellent. So we're done with the tuning fork. So now what I'm going to be checking for is cranial nerves 3, 4, and 6, which is your extraocular movement. So with your head still in midline, just with your eyes, I want you to follow my fingers, okay? And let me know if you have any pain with this at all. Any pain at all? No? Okay. So now I'm going to test for some facial sensation. On your arm, I'm going to have you feel two things, okay? So this is sharp.
Okay.
And then this is dull.
Okay.
All right. So first I'm just going to feel your face with my hands. Does this feel the same on both sides?
Yes.
Okay. Tell me if you feel sharp or dull.
Sharp. Dull. Sharp. 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 Dull.
All right. Excellent. We'll get that out of the way. So now what I'm going to do next is I am going to have you close one ear. Perfect. And I'm going to whisper something. I'm going to be checking for your auditory, okay?
22.
And yep, same thing with the other.
22.
Okay. So it seems like your auditory acuity is intact. Any hearing problems at all? No, nothing like that? Great. So now what I'm going to do is I'm going to use that same light. I'm going to look in your mouth. I'm going to look at your tongue, at the roof of your mouth. All right. So let me grab my tongue depressor. Okay. So, yeah, go ahead. Open up and say, ah. Perfect. All right. Throw that in the garbage. So just keep that mouth nice and open for me. Great. Looks pink. No lesions. Looks moist. No abnormalities. Your teeth all look intact. No braces. I'm looking at the roof of your mouth. I'm looking at the bottom of your mouth, the floor of your mouth, the sides. Excellent. All right. Perfect. So then what I want you to do is stick your tongue out and go from the left to the right. All right. And now press on my hand with your tongue. Great. Perfect. And I was just assessing for the tongue muscle strength. That looks good. It looks like it's all intact. I'm going to have you open up your mouth one more time. With that same tongue depressor, I'm just going to visually inspect your tonsils and your uvula. I'm just going to be looking for uvulary symmetry. All right, tongue out, my dear. Thank you. Perfect. I'm going to grab that light one last time. Perfect. So the tonsils are still intact. The uvula is symmetrical. No redness or white bumps or anything like that. Sometimes that can indicate strep throat. Any problems swallowing at all?
Not at this time.
Not at this time? Okay, perfect. So then from there, we're going to move into the neck inspection. Okay? So first, I'm just going to move your hair out of the way. And same kind of thing. I'm just going to visually inspect for any scars, for any abnormalities. Everything looks okay. I'm going to palpate. Okay? You tell me if you have any pain at all. Any pain at all there?
Nope.
No. Okay, perfect. So now what I'm going to do is I'm going to check your range of motion in the neck. So I'm going to have you do some, flexion, extension, to the left, to the right, and then ear to the side and ear to the other side. Perfect. So now what I'm going to do is I'm going to palpate your lymph nodes, okay? Your lymph nodes, I can feel them. They do not seem enlarged. Are they tender at all? Any pain with that at all? No? Okay, perfect. So now I'm going to palpate the carotid pulse, okay? I'm going to feel it on both sides individually. Good. Perfect. So now with the bell of my stethoscope, I'm going to listen for any carotid bruise. Yep, so you can turn your head just that way a little bit. Okay, no bruise noted. Perfect. Okay, so now I'm just going to visually inspect your trachea. It looks midline. No deformities. Can you swallow for me? Okay, any pain with swallowing at all? All right. Now I'm just going to palpate the thyroid. And the same thing. Can you swallow for me? Okay. Even, it is symmetrical. Everything looks good with that. No hypertrophy. I didn't feel any nodules on your thyroids. Sometimes that's where you can get some nodules if you get like chronic infections or anything like that. Now what I'm going to do is I'm going to have you lay back. I'm going to check for any jugular vein distension. Perfect. All right, so I'm going to have you turn your head about 30 degrees. I'm just going to assess for any distension. Perfect. Nothing there. And nothing there. All right, Miss Chandakir, I'll help you.
Thank you.
Sure. All right. And with that, we're going to move on to the posterior back and chest, okay?
Okay.
Sorry, excuse me. I'm just going to move our stretcher a little bit out of the way. Okay. But still in line with the visual fields of the camera. Sorry, let me get back here. Okay. So same thing with the back of this thorax as I do with every part. I'm just going to assess and inspect. Do you have any back injuries, any pain, any tenderness there?
No.
No? Okay. So I'm just going to palpate. You let me know if you have any pain or tenderness at all. Any pain, any tenderness?
No pain.
Okay. I'm going to place my hands at about the 10th intercostal space. And can you take a deep breath for me? Perfect. And another one. Perfect. So your respirations are clear. Well, they are symmetrical. The expansion is symmetrical. So now what I'm going to do is I'm going to be testing for tactile phremitis. So it's just going to be my hands placed around your areas of your back.
Okay.
And I'm going to have you say 99, and I'm going to be feeling for any vibrations, okay?
Okay.
Tactile phremitis.
Go ahead.
99. 99. 99.
Okay.
99.
Perfect. So now I'm going to listen to your breath sounds. When you feel the stethoscope placed on your back, if you could just take some deep breaths for me, okay?
Okay.
Go ahead. All right. All lobes are clear. Any coughing, wheezing, anything like that you've noticed?
No.
When is the last time you've had to use your inhaler?
It's been a while.
It's been a while, like a year, a couple years?
Probably a couple years.
A couple years? Okay. So next what I'm going to do is I'm going to percuss, and I'm just going to be listening for Renaissance sounds throughout, okay? So I'm just going to take my fingers and tap on my other fingers. Go ahead. Okay, and it is resonant throughout. This next test I'm going to do is called Egophony. Egophony is a test that's going to be checking for any consolidation, any pleural effusions. So I'm going to have you say E when you feel my stethoscope placed on your back, okay?
Okay.
Go ahead.
E. 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 E.
Perfect. This next test is bronchophony, and it's going to be testing for the same thing. So for any consolidation, any fluid in there, or any pleural effusions. So I'm going to have you say 99 when you feel my stethoscope placed on your back, okay?
Sure. 99. 99. 99. 99. 99.
Perfect. All right, so both of those tests were negative, which is a good finding. All right, let's get on out of here. So we're all done for the posterior portion of that and the thorax. I'll move you back over. All right, so we're going to start the same way. I'm going to inspect your anterior chest. Get this behind. Any pain at all?
No.
Okay. It looks symmetrical. Your shoulders are upright. I don't see any scars. I don't see any bruising. I'm going to continue. Any pain at all?
No.
Okay. All right, so next what I'm going to do is I'm going to percuss the chest the same way I did the back, okay? So just by tapping my two fingers over my middle and pointer finger. Perfect. And now what I'm going to be doing is I'm going to be palpating for your apical pulse, okay? Pardon my reach. If you feel any discomfort at any point, just let me know. Any pain at all?
No.
Okay, perfect. And I feel right under here, I feel the point of the maximal impulse, which is a good finding. So next what I'm going to do is I'm going to listen to the breath sounds on your anterior side of the chest. So same thing whenever you hear whenever you feel my stethoscope, if you can just take a deep breath for me. We'll come right over here. One more. All right. So now I'm going to be listening for your heart sounds. Okay. So I'm going to be listening in a couple different places. You can just breathe normally for me. Okay.
Okay.
So I'm going to start in the aortic. Go to the pulmonic. We have the mitral. Sorry, excuse my fingers. And the tricuspid. Okay. And S1 and S2 is audible. I don't hear any murmurs. I don't hear any rubs. Any cardiac history yourself?
No.
Anything like that? Any chest pain?
No.
Nothing like that? All right, perfect. So that completes the anterior chest. So
Okay.
from here, we're going to move into the abdominal.
Okay.
Okay? So I'm just going to have you lay back.
Okay.
Get those feet up. All right. Perfect. So I'm going to have your shirt up. Okay. So first I'm just going to be inspecting the skin color is appropriate for ethnicity. Okay. No bruising, no lesions, no visible masses or anything like that. Any belly pain at all before I do anything? Okay. So next what I'm going to do is I'm going to listen to your bowel sounds in all 4 quadrants, okay? So I'm going to use my stethoscope, and you can breathe normally while I do that. I'm going to use the bell. All right. Bowel sounds are audible and normoactive in all 4 quadrants. So now what I'm going to do is I'm going to percuss the abdomen the same way I did your front and your back. All right. Perfect. Sounds are resonant throughout. All right. So now I'm going to lightly palpate your abdomen, okay? Let me know if you have any pain or discomfort with this at all. Just trying to feel for any masses, any deformities. All right, now I'm going to go into the deeper palpation, okay? Same thing. Let me know if you have any pain at all. Okay, any pain with that at all?
No.
No? Okay, perfect. Sorry.
That's okay.
All right, my dear. So we can actually have a seat up again. I'll help you up with that.
Thank you.
Okay, sure. And then actually, what we're gonna do is I'm gonna have you. We're gonna do 2 more tests. Okay. One is called the Murphy sign. So I'm gonna have you lay back again. And okay. So what I'm gonna do is I'm gonna have you take a deep breath. I'm gonna palpate
Okay.
right under here on this right side. Okay. Deep breath and then go ahead, exhale. Okay. Any pain with that at all? No. Okay. Perfect. So then we just have one more test. We're gonna do the obtruders test, and that's gonna check for any appendix irritation. So for this test, what we're gonna do is I'm going to take your one leg, and I'm gonna have your knee and your hip flex a little bit. Yup. Perfect. And then I'm gonna rotate it. Okay. Let me know if it hurts at all. If you get a shooting pain up here, that would be indicative of any appendix irritation. Okay. Any pain at all?
Nope.
All right, perfect. So both those tests were good. All right, now we can have a seat up. Perfect. All right. So then after the abdomen, from there I'm going to be checking out your upper extremities, okay?
Okay.
So I'm just going to inspect them. Symmetrical. Perfect. They're warm to the touch. Does this feel the same on both sides?
Yes.
Okay. So now what I'm going to have you do is we're going to check for range of motion. So if you can spread your arms up for me, perfect. If you can put them back for me, perfect. Flex like you're doing a barbell. Yeah, barbell curl them in. Perfect. Extend them out. Great. So now same thing with wrists. To the left, to the right, up, down, and then just little circles for me. All right, perfect. So now I'm just going to palpate the joints. If you have any pain at all when I do this, just let me know. Just looking for any abnormalities, deformities. Any pain there? Nope. Any pain in those wrists or in these fingers?
No.
No? Okay. Now I'm going to assess your radial pulses. I'm going to feel one side first. Good, it is strong. I'm going to feel the other side. Great, and now I'm going to feel both at the same time. They are equal, and we're going to do the same thing with the brachial pulses. Perfect. Other side. And then same. Okay, so now we're going to do some deep tendon reflexes.
Okay.
All right, so we will start with your tricep reflex. This one's, yep, if you remember from our last exam, yep. So what I'm going to do with the bell of my stethoscope, I'm just going to hit, and we'll just, sorry, excuse me, no, we're in a tight room. Perfect, okay. And now I'm going to check for the brachioradialis. So you can just put your arm out straight, yep. I will hit with the bell of my stethoscope. Okay, excellent. And then we're going to do the bicep as well, okay? So, yep, 1, 2, 3, perfect. We're going to come over to the other side, do the same thing. We'll start with the tricep, yep. 1, 2, 3, okay. If you want to put that arm nice and straight out for me, the brachioradialis, 1, 2, 3, and then we'll do the bicep again, okay? 1, 2, 3. All right. Excellent. So now I'm just going to be testing for strength, okay? So again, put those arms up. All right, don't let me push down. Perfect, don't let me pull up. Okay, good. Go like a bicep curl. Great. Don't let me pull and don't let me push. Perfect, squeeze my fingers. Perfect. Can you put your fingers apart? Don't let me pull in. All right, put your fingers like that. Yep, don't let me pull out. All right, that sounds good. So now I'm going to do 2 tests, testing for carpal tunnel. Okay. So one test is a Tinel sign and the other is a Fallon sign. And like I said, they both just test for any carpal tunnel.
Okay.
So we'll start. If you can just put your hands like that for me. Excellent. We'll leave them there for a couple seconds and let me know if you have any pain, numbness, or tenderness or anything like that. Any pain at all? No? Okay. So now, yep, if you can just put one arm straight out, palm up, great. I'm just going to tap on the nerves here. Like I said, another test for carpal tunnel. Let me know if you have any pain or discomfort.
Okay.
And I'll turn this time, okay? Any pain?
No.
Okay, now I'm going to go down to the index finger and I'm going to work my way up to your elbow. Let me know if you feel any discomfort, pain, tingling. Nothing?
Nothing.
Okay, excellent. So that is good with your upper extremities. So now we'll move to the lower extremities. Okay. So same thing. I'm just gonna assess for color, for some symmetry. Everything looks good. I'm gonna palpate your joints. So yeah, just like that. Any pain in those hip joints?
No.
Okay. Any pain in the knee joints?
No.
Okay. Any pain in the ankles?
No.
Or any pain in those toes at all?
No.
Okay, so now I'm going to have you lay flat. We're going to do something called the Lachman's test. And this is checking for any anterior cruciate ligament tearing or rupturing.
Okay.
So I'm going to have you put this knee at a 30-degree flexion. Okay, and I'm going to translate the tibia anteriorly. And let me know if you have any pain at all.
No pain.
Any pain with that at all?
No.
Okay, so really I'm feeling for any soft, mushy parts, and that could indicate a tear or a rupture, but everything looks good, and I'll do the same on this other side. Sorry, no, I've got the computer in the way. Okay. Perfect, and then back down. All right, my dear, we can have a seat up again. Sorry, a lot of movement. It's like a workout for the day.
That's okay.
So then next, we're just going to check the range of motion in your hips. So, and all that kind of stuff. So if your knees, can you flex? Yep, extend. Perfect. Can you make them go out? Yep, and in. Adduct. Perfect. And then same thing with your ankles. Flex. Yep, extend to the side. Perfect. Excellent. Can you do some ankle circles for me? Yep. Any pain at all with that?
No pain.
Okay. So now I'm going to check some strength here.
Okay.
So don't let me pull. Good. Don't let me push. Okay. Up on my hands. Perfect. Down. Don't let me push. All right. Excellent. I'm going to have you lay back. I'm just going to check your hip range of motion.
Okay.
Go away. Okay. So we'll put your, we'll rotate it in. Good. Any pain at all with that?
No.
Okay. We'll check the other range of motion. Yep. In. Out. Perfect. So now I'm going to test some strength. We can bend this knee again. All right. Don't let me push in. Perfect. And don't let me pull out. Excellent. Same thing on this one. Go ahead. Don't let me push in. Perfect. And don't, yep. All right. Come on up. So now what I'm going to do is I'm going to feel some sensation On your legs, let me know if you feel it equally, okay?
Yep, it's equal.
Okay. And I'm going to grab my little tool. I want you to close your eyes. Tell me if you feel sharp or dull, okay?
Okay. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Perfect. And did those feel the same on both sides? Great. Now I'm going to check your deep tendon reflexes, so your patellar reflex and your Achilles reflex.
Okay.
So with the bell of my stethoscope, I'm just going to hit on to the patellar part of your knee, okay? 1, 2, 3. Perfect. 1, 2, 3. Okay. I'm going to do the Achilles reflex now. 1, 2, 3. And 1, 2, 3. Perfect. Now I'm going to palpate your pulses. Okay, so I'm going to go for the popliteal pulse. Yep, which is actually right on the underside of the knee. Okay, now we're going to go for the posterior tibial, which is down here. Good, they're strong, they're equal. Okay, and of course we're going to go for the pedal. All right, perfect. So now for a movement of coordination, what I'm going to have you do is called the heel to shin test.
Okay.
So I know we've done this before. So with the heel of your right foot, I want you, up, and then down, perfect. And then same thing on the other, up, and then down. Another test for coordination that we're going to do is called a rapid movement test. So I want you to put your hands together, and then to your thigh. I want you to put the hand part down,
Okay.
and then back up,
So up,
down to the thigh, back up,
up.
and then back your hands, and then back up. Yep, go ahead. Perfect. And another test of coordination that we're going to do is a finger to nose test.
Okay.
All right. So what I want you to do is, keep your head nice and still. I'm going to have you touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. All right. Perfect. Any weird sensation with that at all? Any problems with that? No? All right. So now we're getting to the end of it. I'm just going to have you stand up. And I'm just going to generally inspect you. I'm going to look for any scoliosis, any kyphosis, any lordosis, anything like that. You look good. You're not swaying. Can you just do me a favor? Close your eyes. Yep. Perfect. And then put your hands out with your palms facing up. All right. I'm looking for any abnormalities or any drifts. Now, don't let me push down. All right. Excellent. Any pain or odd sensations with that? Okay. Perfect. So now what I'm going to have you do is I'm going to have you just do a little walk. Good. And now walk on your toes, please. Walk on those heels. Now walk like you're catching a bus, like you're in a rush for something, or me to work every day. All right. So now I'm just going to be looking at your spine, okay? So I'm going to be looking for symmetry. Perfect. Any pain in the cervical or region at all?
No.
No. Okay. Perfect. So now what I'm going to have you do is I'm going to place my hands right at your hips. Can you bend down and touch your toes for me? Perfect. Now extend backwards. Yeah, big back bend. Perfect. To the left. To the right. Okay, and if you can just rotate. Yep. Perfect. Any pain with that at all?
No.
Okay, good. Seems like you're pretty flexible. You got a good range of motion. So then the last thing I'm going to have you do is I'm just going to do a Brudzinski sign, which is checking for meningeal irritation.
Okay.
So I'm going to have you lay down, and your feet can be flat out in front of you. Perfect. So I'm going to take your head, and I'm going to move your chin towards your chest. Okay. I'm going to be looking for your leg reflexes, and that could be a sign of meningeal irritation. Okay. Perfect. Any pain with that at all?
No.
Okay, and your legs did not come up, so that was a negative test, which is good. A negative test is normal. I can help you back up here?
Thank you.
Yes. So Miss Chandic, that concludes our full body head to toe. Do you have any questions for me at all?
No, I don't.
Okay. As usual, I just recommend that you follow up with me in about a year for another full body assessment. All your vital signs were great. We did those out in the waiting room. They were all pretty standard. No fevers, no temperatures. We did the Snellen chart. Your vision was 20 out of 20. So everything checks out pretty good today, okay?
Fantastic.
Yep, just keep up with your medications, with your therapy, your massages. I think that'll be great, okay?
All right.
All right,
Thank
good
you
to
so
see you.
much.
Yep.
Have a great day.
You too. Bye.